Tonight, our I-Team investigates excited delirium. It's a controversial term law enforcement sometimes uses to explain why people die while in custody. Senior investigative reporter Paula Vasan examines the arguments some make and the criticism coming from families and analysts.
Outside the home that reminds him every day of loss.
I'm always proud of him.
And heartache.
He was a better person than me.
Larry Graves tells the I-Team.
They deny liability.
Police have gotten away with murder.
It's painful. It's really painful.
4 years ago.
Free-spirited, easygoing.
He lost his only child.
Oh, he had suffered from schizophrenia for over 20 years.
A witness said he was acting erratically and threatening violence. It led to an encounter with police.
And that's where things went wrong.
He says his son, Julius Graves, was sitting at a bus stop near Forest Park. He was tasered, then injected with sedatives. Police kneed him in his midsection and held him face down on the ground. He went into cardiac arrest and died 5 days later. On the medical examiner's report, his father saw a cause of death that did not make sense.
And you saw that your son died from what's called excited delirium. What was your reaction?
I never heard of that term, so you had to Google it.
The term excited delirium is controversial. Many researchers and medical professionals argue it's racist too, a term used to describe severe agitation, superhuman strength, and sometimes sudden death in encounters with police. And researchers say it's been used for decades to help clear law enforcement of wrongdoing after someone dies in their custody. Many of the country's leading medical organizations have said excited delirium is not a diagnosis.
In early October, California became the first state to ban the term as a cause of death. But around the country, we discovered it's still being used. Our sister station, KUSA in Denver, has linked more than 150 deaths to the term since 2010, leaving people, just like Graves, in the dark about how and why their loved ones died.
Pat was 3 years older than I was.
Richard Burns is the exception. The I-Team talked with him at his home in Springfield, Illinois.
It's been a long struggle.
It's been 13 years since he lost his brother.
He was the best man at my wedding. I was the best man in his.
He's a white male wearing an orange shirt and no.
Patrick Burns suffered from bipolar disorder. The family's attorney tells the I-Team that on a winter day in 2010,
Subject has forced entry into the residence.
he went into his neighbor's home by mistake, thinking it was his.
I don't know where they've gone now, and I'm scared.
The neighbors called police, who handcuffed him.
Suspect been tased multiple times.
Police reports show they tied his hands and feet together,
We're going to try to get him on a stretcher.
then tased him about 20 times.
10-4.
Police held him in a prone restraint position, or face down.
He's pretty whacked out.
It made it hard to breathe. 5 months ago, the county coroner corrected his brother's death certificate, replacing excited delirium with prone restraint asphyxia. It means police suffocated him.
Many people were being misled by this term.
It is an excuse or to harm them.
Kelly Gillespie is a St. Louis University law professor. She believes all states need to ban law enforcement and medical examiners from using excited delirium to justify forceful restraint and death.
Do you believe police are not being held accountable?
Yes, that's true. They tend to involve Black men, some of whom have serious mental illness.
Research published in 2021 found Black and Latino people accounted for 56% of reported excited delirium deaths over a 10-year period.
What's a better solution?
Systems where we have trained mental health providers to respond, right? Really robust training in de-escalation techniques.
Graves believes that would have saved his kind-hearted son.
He tried to pass out money to people and stuff. He was a good person, you know, that suffered from a horrible disease, like cancer and anything else.
Citing government data, a report released by 2 Washington, D.C. based nonprofits show the federal government has undercounted deaths in custody in 2021 alone by nearly 1,000 people. It's referred to as a black hole in our criminal justice system. For the I-Team, Paula Vasan, 5 on your side.
St. Louis police deferred us to the city medical examiner's office, which says excited delirium is rarely used as a cause of death in the city, and when it is, it's never the sole cause of death. If you'd like to get in touch with our I-Team, just leave a voice message at 314-444-5231, or you can email Paula directly at tips@ksdk.com, and all calls and correspondence will be kept confidential.